We are continuing our discussion on the coronavirus or COVID-19 pandemic. And with new case numbers on the rise throughout the country and increasing slightly here in Florida, many residents are questioning what we should do next. Face masks are still required throughout many Central Florida communities, and more vaccines and testing sites are opening to accommodate the numbers. So what does all of this mean for you? Well, on this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Let's get an update from our state medical professionals. And joining me is Alvina Chu, epidemiologist with the Florida Department of Health in Orange County. Alvina, thank you for joining us as always.
Thank you for having me.
So Alvina, we're moving through lots of people who are getting vaccinated, and lots of people now have questions about what they should be doing. So the number one question is, after you get vaccinated, should you still wear a mask?
You should, for now. So you're not considered to be fully immune until about 2 weeks after you've gotten your last dose in the series or your dose of a single dose vaccine, like the Johnson & Johnson. So you need a little bit of a time for your immunity to build up, and so you should still continue to wear a mask during that time period because you aren't fully immune and might still become infected. Also, the vaccines are really great at preventing severe illness and hospitalizations and deaths in persons who've received it, but we are still trying to gather more information and more research about your capability to transmit the virus even after being vaccinated, which we believe is very low, but are still waiting for some more data and to be able to provide that kind of guidance. And not everyone is vaccinated just yet. And so until we can all be vaccinated and we're all protected, we recommend that you continue the pandemic precautions so that we can get a handle on this pandemic to reduce transmission of new infections.
You know, there are lots of people who are still a little bit fuzzy about who is actually eligible for the vaccine because there have been so many changes so fast. Who's eligible now?
So right now, we're at the widest availability possible. So anyone who is eligible to receive the vaccine, that is medically eligible, so those 16 and older for Pfizer and those 18 and older for Moderna and Johnson & Johnson are eligible to receive those vaccines.
And I know that there have been some changes in locations for vaccinations, or going to be changes at the convention center, for instance. That's going to change. Where can people get vaccinated?
So currently, we'll be at the convention center through the end of May. We're giving our first dose of Pfizer on May 5th to make that transition into other community locations. And so you can keep abreast of those developments at the Orange County government website, which is ocfl.net, and then also through the Florida Department of Health website, myfloridavaccine.com.
You know, Alvina, there are some reports of people who have actually gotten COVID-19 after they got vaccinated fully. Is that something that actually can happen?
It does. So not every vaccine is perfect, kind of like not everything in this world is perfect. And so this is part of the efficacy or part of the effectiveness assessments of the vaccine. And so we know that it is possible that there may be some persons who become infected with COVID-19 after getting the vaccine. What we do know so far is that even if that happens, we haven't seen any severe illnesses, hospitalizations, or death from this. So the vaccine, while not completely protecting you from getting infected, probably helped reduce the likelihood that you were going to develop a severe illness. And so we still would like to encourage persons to get the vaccines to help protect themselves from these severe outcomes.
And, you know, speaking of which, the CDC has taken a pause on the Johnson & Johnson vaccine. Are there concerns that we should be looking for if you've either had it or that's the one that you were planning to take?
So right now there is the pause on the use of the Johnson & Johnson vaccine in the United States, and the the 6 events that happened were incredibly rare, but also quite serious. And so the CDC and the other governing bodies who are responsible for making the recommendations for the use of vaccines in the United States are taking a pause to review additional information, gather some more information about what the rates are like in different populations, and trying to decide how best to move forward. We would still like people to know that there is still the pandemic happening, and so the possibility that you could become infected and then develop severe illness or possibly die from a COVID-19 infection is still real. And we still have the Pfizer and Moderna vaccines in use and have not seen severe adverse events related to those. And so we would like to still encourage persons to get vaccinated. If you've already received the Johnson & Johnson vaccine, please be aware of if you develop any complications or illness, to consult with your healthcare provider and also let them know what you're experiencing and that you have recently had the Johnson & Johnson vaccine.
You know, we are just getting over through the end of the spring break season, and most people are wondering if the numbers among young people are going up or are going to go up because of spring break.
So we have seen, after there's the opportunity for persons to gather with a lot of other people without the use of masks or with more risky behaviors and not using pandemic precautions, that there has been an increase. What we've seen so far is a slight uptick in the younger population. So between 5 to 14, we've seen an increase of cases there, and especially the percent positivity. So that might be one indication of potentially under-testing. And then we have seen an increase in the age groups that are the 15 to 34, which has been sort of the overall throughout the pandemic, the age groups that have had the riskiest behaviors and contribute the greatest proportion to the numbers of cases every day. So especially for those persons who are eligible to receive the vaccine in those age groups, those 16 and up, we would encourage everyone who is medically eligible to take it, to get it, so that we can reduce the numbers of infections. What we've seen in the older populations that have a very high proportion of those vaccinated, such as in the 65 plus age group, that the severe hospitalizations and deaths have greatly decreased, as have the proportion of infections that they contribute daily to our case counts.
You know, we're hearing more and more about the spread of variants, the COVID-19 variants going through the community. Are these vaccines, are they effective against the variants?
So currently the vaccines are very effective at currently these vaccines are very effective at preventing severe illness, hospitalization, and even death. And even for those cases where persons might have been infected with variants. And so as a population, the vaccines are effective to varying degrees, but as I had mentioned before, even if you get possibly a breakthrough infection or an infection after getting vaccinated, we haven't seen persons having severe illness or deaths. And so it is, regardless of whether or not you have, say, the wild type or a variant, the vaccines appear to be effective at this time.
Well, Alvina, we always appreciate you keeping us informed from the front lines of this pandemic, and thank you for your time today.
Thank you so much.
And we'll be right back with more. Stay with us. As vaccination numbers increase across the country, some people are still questioning how effective the vaccines are, or for that matter, how safe they are. Dr. Anibal Maldonado with the Infectious Disease Department at AdventHealth is here to discuss more. Dr. Maldonado, thank you for being with us today.
Thank you for the invitation and the opportunity.
You know, there are communities, particularly the Latin community, that are really skeptical about whether or not the vaccine is going to be safe for their family. What would you tell them?
I think the message has to be that the vaccine is safe and is effective Scientists have been working with this technology for over 20 years. And this is not the first time that we encounter a coronavirus, obviously not at this level, but a monumental global effort, both from the private sector and the government sector, have actually put forth the vaccines that we have today under the most strict protocols to ensure safety and efficacy. So yeah, the answer is that they're safe and they're very efficacious.
And as you say that, Dr. Maldonado, we hear stories of people who have actually died after taking the vaccine. Are those rare? Is that something we should be concerned about?
They are very rare events. We have 3 FDA-approved vaccines here in the U.S. We have the Pfizer, the Moderna, and most recently the Johnson & Johnson. The FDA and the CDC actually suggested to place a pause on the distribution of the Johnson & Johnson this week, secondary to some rare side effects involving approximately 6 patients out of approximately 7 million patients that have been vaccinated. What they saw, or what they've been studying, is that there were some very rare cases of blood clots in the brain. This is seen also with COVID-19, not necessarily related to the vaccines, but we are looking at that data very closely. The CDC and the FDA are looking at that data, and we'll have an answer shortly whether we're going to continue to be able to use the Johnson & Johnson. My expectations is that in the whole magnitude, the number of cases is so low compared to the number of individuals that have been vaccinated that they most likely going to give them a green light. We will see, but we have not seen any other significant side effects with the Moderna or the Pfizer vaccine.
You know, there's a whole nother group of people who are worried about side effects after taking the vaccine and how severe those will be. What would you say to those people?
The most common side effects associated with the vaccines are a local site injection, maybe some discomfort, some fevers, some muscle aches. These are very common side effects associated with any vaccines with other vaccines that we have used in the past. And it's basically a response to the vaccine and the immune system creating proteins and antibodies in order to protect you from the virus in the future. So they are usually self-limited symptoms, and they last anywhere from 24 to 72 hours. So nothing significantly to be concerned about in terms of serious side effects. The side effects that patients may experience is just a natural response from the body, creating protection so you can be protected from the virus in the future.
Will the current COVID-19 vaccine protect us from the variants that are out in the community, or will we need a booster shot from time to time?
So there are multiple variants in the community at this point. The most common one is what we call the B.1.1.7, which originated in the United Kingdom. And the data that we have so far is that the Pfizer and the Moderna vaccine and even the Johnson & Johnson provide adequate protection against this variant. Now, as you know, and as we've heard in the news, there are multiple variants out there, some of them which are not necessarily covered as efficient by the vaccines that we have at the moment. So those companies are actually trying to create new boosters. It's possible that we are going to need some type of reimmunization or a booster in a period of 6 to 12 months. That remains to be seen. But I anticipate that with so many variants that we are encountering over the last several months, this is a possibility. Just as we need an influenza vaccine on a yearly basis, I anticipate that we are going to need a booster for the COVID-19.
You know, there are increasing reports about the uneven amount of vaccines that we have when it comes to people in the same household, where some people have been vaccinated and some people aren't. Is it safe to be around, is it safe for someone who's not vaccinated to be around people who have been vaccinated? Does it make it safer for them because the people around them have been vaccinated?
So I think to a degree it makes them safer, but we also have to keep in mind that patients that have been vaccinated in rare occasions can also carry the virus in an asymptomatic way, right? Where you don't manifest any symptoms. And there is a possibility that you can transmit that virus to patients that have not been immunized. So the CDC recommends that if you've been immunized, that you can be in the same household with individuals that have been immunized without wearing a mask. In any other situation, it is still recommended that if you are around individuals that have not been immunized or are at risk of developing severe COVID, like patients with diabetes, high blood pressure, obesity, that one should continue to wear a mask, practice social distancing, and continue to frequent hand washing.
You know, once you actually get the vaccine, there really is a sort of a feeling of a weight being taken off of your shoulders. But a lot of people don't think that they still need to wear a mask or social distance because they've had the vaccine. Is that true?
So if you've been immunized and if you've been vaccinated and you are around other people that have been vaccinated, you may be able to just not wear your mask. However, if you're out in the community in a closed setting, you don't really know which individuals have been immunized and which ones are not. So the question becomes is, if you are immunized, you still have a social responsibility of protecting those around you which have not been vaccinated, because you still have the capacity to maybe carry the virus, don't manifest any symptoms, and transmit it to somebody that has not been vaccinated. So we still don't know. The data is coming out as to those of us that have been vaccinated, what's our real chance of catching the virus and our ability to transmit it to other individuals that have not been immunized.
So when in doubt, be careful, no matter what.
Absolutely. If you are in the community, outside in the community, the recommendations are to continue to wear masks, social distancing, and washing your hands. If in your household everybody has been immunized, it is safe to keep your mask off and then just share that space with those individuals that have been protected by the vaccine.
Well, Dr. Maldonado, thank you so much for keeping us informed about the pandemic. We appreciate you today. Thank you.
Thank you for the opportunity.
And we'll be right back with more. Stay with us. We've heard from a variety of leaders today trying to keep us informed about the coronavirus. From local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve this community. And we are also here to help you keep making those healthy connections. Stay safe.